This is going to be our right ventricle.
Sure. But if you face
It's the heart rate.
Yeah, the heart's facing you guys.
Oh.
So let's say, this is the heart, right? The heart was in my body. This is the right side of the heart. This is the left side of the heart.
Okay.
So this is like if you guys were looking at me. Okay. This is the right ventricle. And this is going to be our left atrium. This is going to be our left. All right. Now you guys told me that we have veins that bring blood into the heart. Do you guys know which of the four parts of the heart the veins dump the deoxygenated blood into?
Right.
Okay. So I'm hearing a lot. So I think I heard majority of people said right. Is that right, guys?
Yes.
Most people agree on the right. And that's going to be the right atrium or the right ventricle?
Atrium.
Okay, atrium. That's okay. Now, a good way to kind of remember this, and maybe if it will help you guys with remembering, is A comes before B, so it'll come to the atrium before the ventricle. That helps, maybe? Okay.
Maybe.
All right, so we're going to have veins. They're going to come to the right atrium. There's two big veins that come into the right atrium. You guys know the names of these. I'm going to be super impressed.
Isn't it like superior?
We're super close, and that's actually super awesome that you're remembering it. So, superior vena cava is one of them.
Is that his what?
Superior vena cava. Super, I know, right? Like, it's not. Look, when you guys will see, one of the things in medicine is we have crazy names for things, and you just kind of have to go with it. So, superior vena cava, and guys know what superior means, right?
Yeah.
So, like above, right? So, superior vena cava is going to be bringing all the deoxygenated blood from above the heart. So, we're going to have the superior. So that's going to be coming in above. And all the veins from above the heart go here. And then if we're going to have a superior vena cava, that means we also will have a inferior. Nice. Awesome. We'll also have an inferior vena cava.
Now that just comes into the right side of the heart.
Mm-hmm. So this also will come into the right side of the heart. Inferior vena cava, he's going to be bringing all the blood from your legs, your gut. All that stuff is going to be coming from the inferior vena cava. Superior vena cava is going to be draining all the blood from your arms and from your head. Kind of make sense? Okay. Now, we're going to have all this kind of deoxygenated blood is going to come and it's going to collect in the right atrium. The way I kind of like to think of atrium is they're just kind of good points for the heart to be collecting the blood. So it's just more of this kind of big chamber, to think about it, where all the blood's going to kind of come in. From the right atrium, it's just going to dump right into the right ventricle. Okay? Now the right ventricle, he's a pump, right? Our right atrium can sort of pump, but not really. The right ventricle, he's got a lot of muscle behind him, and he's a pump. It's a good way to think about it. Remember I said, like, the heart has kind of a series of contractions and relaxations, right? So the right ventricle, with how this works, is you're kind of continuously dumping blood into your right atrium. The right ventricle is going to relax, and it's going to have blood flow into it. Kind of after it relaxes, we have all this deoxygenated blood, right? We need to get oxygen to this blood. So where do you think is probably the next logical place that we need to get oxygen for the blood from the right ventricle to go to? Perfect. So the right ventricle is going to go ahead, relax. It's going to take all that blood in, and then it's just when it gets enough blood in that chamber, it's going to go ahead and pump it all out to the lungs. That makes sense? The kind of concept of where it's going to relax, kind of fill with blood, and then you're just going to go ahead and pump it all out. Go ahead.
So you know, typically like my heart hurt. What that mean? Like it's pumping too hard or something?
So that is a great point. Like when people have a heart attack or something like that.
Or like if you just sitting down and you're like, oh, my heart hurts.
Okay. That is a.
No, my heart burns. I'm just sitting there like my heart
So
hurts.
Tiana, that is
Like
actually.
running or something.
So that's a fantastic question. We will get to aspects of that. There's a lot of things in this area of the body that can actually make your heart hurt. And I will get to that. If I don't get to that, make sure I do, okay? Because that's a great question. We'll talk about a couple of things that can make the heart hurt. All right, so the right ventricle is going to bring the deoxygenated blood to the lungs. Now, if there's going to be something taking blood away from the heart, what type of blood vessel is that going to be? Artery, perfect. So it's going to take blood to the lungs via an artery. And does anybody know what that artery is called?
The aorta.
Close, we'll get to the aorta. So it's going to be the pulmonary artery. Pulmonary is just our fancy name for lungs. So now, when we talk about kind of this blood flow, right? We have a hole between the right atrium and the right ventricle, and a hole between the right ventricle to kind of push it into the lungs, right? Now we've got two holes in this right ventricle, right? So if this thing's going to be squeezing, how are we going to get blood into the pulmonary artery without it going back into the right atrium?
It's gonna contract. So
It's going to what?
contract
Okay, so what's going to contract?
the right atrium and the right ventricle.
Okay, good. So I like where you're going with that.
Don't they got like a flap? Yeah.
Right, so like a flap. So you're thinking like it kind of constricts between them, right? That's what you were saying. You're saying there's kind of like a little flap in there. So perfect, guys. I like what you're thinking. So we have something called valves. And what happens is there's a little valve here, and it closes. So right before this thing's going to contract or push all the blood out, we have a little valve here that will close it off between the right atrium and right ventricle, so you don't push blood back up into the right atrium.
That don't happen like I heard somebody had to get a valve for a pig or something.
A valve replacement?
Yeah.
Awesome. So
Do they get them from pigs? Do they get them from pigs?
when do they get?
From pigs? Like one?
Like get them from pigs.
Pigs? Yeah, you can get them from pigs.
Like
You actually, they actually have pig heart valve replacements. You can get them from cows. You can also get them from, I know. You can also get them. It's kind of cool, right? It's kind of amazing though when you guys think about it, right? So like if you have a piece of your heart, so if you guys have a piece of your heart that kind of peaks out, we can actually replace it. That's kind of amazing to think about, isn't it?
Wait, that is what?
So if we have a piece of our heart, like those little valves can get a lot of stress on them. If that part of the heart fails, we actually, in medicine nowadays, we can actually replace it. That's kind of cool, isn't it?
Now, you said stress. Now, what can cause that? Is it because too much blood is flowing out of it and it can't contract over?
So that's an excellent question. That can be one cause. There's kind of a lot of different causes. If you can have too much blood flow kind of through there and it stretches out the valve, that can do it. Some people are kind of born with valves that are weak. That's a good way to put it. Some people are born with valves that are maybe a little stiff, so they don't close properly. So there's all different reasons why somebody might need to get their valve replaced. But it's kind of cool that we can actually replace it. Have a question?
Oh yeah, what about having a large heart?
A large heart?
Yeah, a large heart.
Okay, so that's something else. A large heart. So people can have large hearts. And we'll get to that. I like that question. We'll get there in a little bit. And we'll actually talk about that too later in the week. So keep that in mind. If if I don't get to that later, like Tiana's question, remind me, okay? Alright, so same thing here, so we're gonna be we were at right ventricles pumping into the lungs, right?
Right.
So we picked up oxygen for the lungs. That's awesome, right? So now we have this oxygenated blood. Oxygenated blood is going to travel from the lungs to the heart. If it's going to travel to the heart, what type of vessel is it going to use? So it's going to be a vein into the left side of the heart. And if it's going to be, we got the pulmonary artery to get to the lungs, what type of vein will it be to get back? Pulmonary vein. So we have the lungs.
How does lungs be like that?
I mean, the lungs are special.
She said it's 3D.
I'm going to have you guys stretch your imagination. I'll show you guys how it actually works in the body in a second. Alright, so we have the pulmonary vein. Pulmonary vein is going to go into the left atrium. Okay. Kind of remember what I said, guys. Atriums are kind of a place for the blood to collect, so blood will flow from the lungs via the left atrium. Our blood is now oxygenated, which is awesome, so we are ready to pump it into the body. What'd you say? Okay, so we're going to pump into the body. It's going to collect into the left ventricle. Same thing on this side, left atrium, between the left atrium, left ventricle. Our ventricles are pumps, right? So we're going to have the left ventricle is going to relax again, just like our right ventricle did. The oxygenated blood's going to flow in, so we get enough blood collected in there. Left ventricle is going to pump. We're going to have a valve here to close between the left atrium and the left ventricle to make sure that we don't have blood coming back up into the left ventricle. And then the left ventricle is going to go ahead and pump to the body via an artery that Wesley told me earlier about. Aorta. Awesome. What'd you say? Okay. Aorta. Okay. Awesome. Go.
Now, how come it doesn't go to the right atrium, right ventricle, out to the lungs, back up to the left ventricle, to the left atrium? How come it doesn't go like that?
So you guys will kind of see a little bit with how the heart's kind of set up. It's a little funky how I have it here in the box. This is more just kind of for you guys to understand the flow. You're asking why it doesn't go kind of straight from the lungs to the left ventricle?
Yeah.
Just kind of how we're made. I think probably some of it's a little bit with the timing and making sure that we can have the heart kind of contract and relax at the same time, so we can kind of coordinate how the blood pumps out. So like if we kind of went, kept going, yeah, you see what I'm saying? So if we kind of keep having blood just kind of forced into that left ventricle, it's a lot of stress to put on that left ventricle, you know, if you keep kind of, you know, bombarding it with blood. So we gotta have it kind of rest in the left atrium for a little bit, collect in the left atrium, then we're gonna have it come into the left ventricle, allow the left ventricle to relax, and then go ahead and have a nice big contraction, and then pump all the blood up. But
Why is there two beats?
why is there two beats? Awesome, I am getting to that. That is a fantastic question. So, what do you guys know about the heart sounds? So it goes loved up, right?
I remember that.
Okay, so I'm telling you guys, now when I've been talking here, I've been telling you guys about these times of called contractions and these times called relaxations of the heart. There's a fancy name that we have for these words. So the contraction, does anybody know kind of a fancy name for contraction? Okay, so the fancy name that we have for contraction of the heart is called systole. Okay, anybody heard of systole? You've heard that name? Okay. So the contraction of the heart is going to be systole. The relaxation part of the heart is going to be called diastole.
Oh, that's like when you take up blood pressure.
Exactly. When you take the
Made up these words.
I'm telling you that this is the fun part about medicine is you get these tough words. Okay, so we've got systole and diastole. Wesley asked me about what the heart sounds are, right? So what makes those heart sounds? Remember